For millions of people worldwide, this is the rhythm of life. 3 times a week, 4 hours at a time, tethered to a machine that sustains them. The dialysis clinic becomes a second home, a place of routine, but also a place of immense physical and emotional challenge. The constant hum of the equipment, the clinical environment, the long, slow passage of time, it can all contribute to a significant mental burden. Patients often grapple with feelings of anxiety, depression, and a diminished quality of life, feeling as though their identity has been reduced to their diagnosis. The hours spent in the chair can feel like a void, a period of life simply lost to treatment. But what if that time didn't have to be lost? What if those hours could be reclaimed, transformed from a period of passive endurance into an opportunity for positive engagement? What if something as simple, accessible, and non-pharmacological as watching a movie could fundamentally improve a patient's mental health and their entire experience of care? It sounds almost too simple to be true, but a growing body of research suggests this is not just wishful thinking. It's evidence-based medicine in action. Today, on Dialysis Secrets Decoded, we're exploring how a simple intervention is making a profound impact, backed by rigorous scientific inquiry. We'll be taking a deep dive into a pivotal 2020 randomized clinical trial published in the journal Complementary Therapies in Medicine. This study, conducted by Moraes, Moreira, and Winkelmann, set out to answer a critical question: can watching movies during hemodialysis sessions actually reduce symptoms of depression and anxiety, and improve a patient's perceived quality of life? Throughout this episode, we will unpack the methodology and the stunning results of this research, which showed statistically significant improvements for patients. We'll explore the fascinating psychological mechanisms behind why this works, from the power of distraction theory to the science of emotional regulation and stress reduction. We'll also look at the practical, real-world benefits observed in clinics that have adopted this practice, leading to higher patient satisfaction, better treatment adherence, and stronger, more positive relationships between staff and the people they care for. And most importantly, we'll hear directly from patients who have experienced this transformation firsthand, describing it as a mental escape that provides a much-needed sense of normalcy and joy. Join us as we uncover how evidence-based practice is revolutionizing the human side of dialysis care, one screen at a time. Evidence-based practice, or EBP, is the integration of the best available research, clinical expertise, and patient values. It's not just about what works, it's about what works best, backed by science. Let's look at a powerful example of how simple, non-pharmacological interventions can transform the patient experience. In a 2020 randomized clinical trial published in Complementary Therapies in Medicine, researchers Edinara Moraes, Paulo Ricardo Moreira, and Eliane Roseli Winkelmann studied the effects of movie watching during hemodialysis sessions. They recognized that the long, repetitive hours tied to a dialysis machine often lead to significant psychological distress, including high rates of anxiety and depression. Their study was designed to see if cinematic immersion could offer tangible relief. Over 12 weeks, one group of patients was provided with tablets and headphones to watch movies of their choice during their 4-hour sessions. The control group, meanwhile, continued with their standard care, without the structured entertainment. Researchers measured key psychological indicators before and after the study, using established tools like the Hospital Anxiety and Depression Scale. The results were remarkable. The group that watched movies showed a statistically significant reduction in both anxiety and depression scores compared to the control group. Their self-reported quality of life also saw a marked improvement, particularly in the mental health and emotional well-being components. So, what's happening here? The benefits are rooted in powerful psychological mechanisms. First, there's the principle of distraction. A compelling story provides a mental escape, pulling the patient's attention away from the clinical environment, the discomfort of the needles, and the monotonous hum of the machine. It's more than just passing the time. It's a cognitive shift that reallocates attentional resources. This engagement also aids in emotional regulation. Movies can evoke feelings of joy, humor, and hope, actively counteracting the stress and sadness that can accompany chronic illness. For these patients, the treatment chair was transformed. What was once a symbol of their illness became a personal movie theater, and the 4-hour session shifted from a period of endurance to a moment of anticipated escape and relaxation. In 2020, a pivotal study published in the journal provided compelling evidence for a simple yet profound intervention. The research, conducted by Edinara Marias and her team, sought to answer a critical question. Could a non-pharmacological approach significantly ease the psychological burden of hemodialysis? The study was designed as a randomized clinical trial, the gold standard in medical research. 100 patients were divided into 2 groups. The control group received the usual standard care provided during their sessions. The intervention group, however, was given a simple but transformative tool: a tablet and headphones to watch a movie of their choice during 12 consecutive dialysis treatments. To measure the impact, the researchers used internationally recognized and validated clinical tools to assess levels of depression, anxiety, and overall quality of life before and after the trial period. The results were nothing short of remarkable. The study, titled, found that patients who watched movies during treatment experienced significantly lower levels of depression and anxiety. Their self-reported quality of life also saw a substantial improvement. Compared to the control group, the intervention group showed clear, measurable improvements in psychological well-being. This wasn't anecdotal. The difference was statistically significant, reinforcing the therapeutic value of this simple audiovisual distraction. So how does watching a movie achieve such a powerful effect? The primary mechanism is a concept known as distraction theory. The cognitive load required to follow a narrative, process dialogue, and interpret visual cues actively diverts the brain's attention. Instead of focusing on the monotonous sounds of the clinic, the physical discomfort of the procedure, or cyclical anxious thoughts, the patient's mind is transported elsewhere. It's a cognitive shift that provides a genuine mental escape from the immediate clinical reality. Beyond simple distraction, movies serve as powerful tools for emotional regulation. A well-chosen film can evoke joy, laughter, and hope, actively counteracting the feelings of sadness and despair that often accompany chronic illness. This emotional engagement helps reframe the patient's experience, transforming hours of passive, stressful waiting into a time for entertainment and positive emotional release. This psychological relief also has a physiological counterpart. By reducing mental distress, the intervention helps lower the body's stress response, promoting a state of relaxation that is beneficial for overall well-being during the demanding treatment. Furthermore, this intervention combats the profound sense of isolation that many patients feel. While dialysis can be a lonely experience, movies offer a window into other worlds, stories, and lives. Engaging with characters and their journeys provides a form of vicarious social connection, a social surrogate that helps alleviate loneliness. It reminds patients that even while tethered to a machine, their minds can travel, connect, and experience a full spectrum of human emotion, reinforcing their sense of identity beyond their diagnosis.
When we offer patients entertainment options like movies, we're not just making them comfortable, we're applying evidence-based strategies that support mental health and treatment adherence.
Depression and anxiety are common among dialysis patients, often affecting their engagement with treatment. By incorporating movie watching, an accessible, low-cost intervention, we're addressing these challenges head-on.
Watching movies during dialysis helps me forget I'm even in treatment. It lifts my mood and makes the time fly.
This is the essence of evidence-based practice, using research to guide care that's not only effective but compassionate, because in dialysis, every detail matters. Stay tuned for more insights into how science and empathy combine to elevate dialysis care. Evidence-based practice, it's not just theory, it's transformation.